Guys, welcome back to Medical Coding with Blue. Okay, today's episode is how to independently study to become a medical coder without having to go through a medical coding program. Okay, is this possible? I've gotten this question so many times. Is this possible to do this, to study on your own and to go take the test? Absolutely. With AHIMA, the American Health Information Management Association, they allow for you to just take to do self-study and then take the CCA, which is the Certified Coding Associate exam. That is the entry-level exam. That is the only one you would be eligible for if you were doing a self-study. The other credentials, they're going to need you to have like experience or to go through their particular program. But if you want to bypass all of that and you just want to study on your own and see if you could pass the test, that is the test that you can take. Now, with AAPC, or the American Academy of Professional Coders, the way it goes is I believe you have to be a member of their association and you have to have had experience, prior coding experience, in order to be able to sit for their CPC exam. Now, that could be wrong, but I think that's the way it goes. I think, if I remember it right. I'm a member of the American Health Information Management Association, so a lot of my knowledge about AAPC is a little spotty. So I invite you guys to check out both websites. I always encourage you guys to look at both websites. But this video is really intended for those that want to just bypass the school and just sort of study on your own and go and sit for the exam. This also is for students that are maybe getting proctored at school, but not really given those critical thinking skills. How do you develop those? Oh, what do you study? How do you study? Okay, so let's get into it. It was a mouthful, right? Okay, so the first thing that you are going to need if you are going to decide to go with the CCA, okay? If you're going to decide to go with the CCA, you are going to need the following books. Now, I don't have all of them. I only have the diagnosis and the procedure coding book. Now, I will leave a list of all of the materials that you need, but I strongly suggest that you go to the AHIMA website, ahima.org, and I will be leaving that address down in the description box along with the AAPC. Okay, so AAPC people, don't jump on me, okay? I'm including AAPC as well, but with AHIMA, like I said, they allow you to just do independent study and then sit for the exam. So I know it's going to show up as backwards. Sorry. I am not technologically advanced. You guys know this. If you've been with my channel for a while, you all know I am not technologically advanced. Although I do have pictures of these books on my Instagram, Medical Coding with Blue, all one word. This is your CPT book, okay? This is one of the books that you will need, okay? You are going to want to look for the most recent book that you can, especially if you're going to sit for an exam in the same year. Now, right now, this is, we are in March, okay? So this is, the whole COVID thing is going on right now. If you are viewing this in the future of 2021, this time, right now, everything is shut down, okay? So if everything is shut down, we're doing social distancing because of the COVID. So it's going to be a little bit more difficult if you're going to try to do this right now, okay? You may still be able to order your books online. You'd have to see. I heard some people were having difficulty getting their books. Right now, I know that no one is sitting for their medical coding credential exam right now. No one. Either in AAPC or in AHIMA. Nobody is sitting for a credential exam right now. So there's going to be a little bit of a delay, but there's other things that you can do. We're going to talk about the other things that you do need to study, okay? But this is the procedure book. This is what it looks like. Again, it's going to say current procedural terminology, CPT, and it's going to give you the current year. I always go with, this is the AMA version, okay? I always go with the AMA version when it comes to the procedure coding books. You will need a PCS book as well. I don't have one, but that is for the inpatient procedures. This is for the outpatient procedures, okay? And then we have, dun, 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 This is the diagnosis book. So this is the ICD-10 Expert for Physicians. This is made by Optum 360 Coding, okay? Now, Optum 360, this is not an ad, although Optum 360, call me. Look, I love their books, okay? If you go to optum360.com, optum360coding.com, they have lots of coding companions. That is a valuable trove of books that you can order if you are becoming a medical coder, or if you are a veteran medical coder and you need to get more sharper with your clinic. That is the best place to go because they have all the coding companions. They have the in-depth coding books, okay? That's what you want to look for. Now, if your book does not look like this from Optum 360, it may have a different cover just depending on the year. This is the 2020 version. Every year they change the cover. If you are not using an Optum 360 coding diagnosis book, yours is going to look different from mine, obviously. There is another book. I don't know who publishes it. I don't know if it is association specific. That's why I don't want to say. But if yours is not made by Optum 360 Coding, it's not going to have all of the detail. It may have some other things, but it's not going to have the detail that Optum 360 Coding books have. Do I talk very highly of them? Heck yes. Why? Because I've learned so much from them. I've learned so much from their books. They have so many details, so many different editions, and it's got indexes. It's got wonderful indexes for pharmacology and lots of different things. It's got notes throughout the different sections. So again, this is a really great and very comprehensive, very inclusive book. So this is what I recommend. I'm just saying. All right. And I already talked about the PCS book. You will need what's called a HCPCS book. It's an HCPCS book. This book talks about all of the durable medical equipment, and it has the codes for like the wheelchairs and the bandages and all kinds of stuff. Okay. So that book is all about just the detail stuff. This is the other things. And often these are used by departments to sort of take an accounting of all of the materials that are coming in and out of the clinic, or if they're in a freestanding service, this will be able to give you what codes they're using for whatever, like shoe inserts and things like that. So that is what a HCPCS code book is. So that's what it does, okay? You will need it to study with. As far as taking it to your exam, I don't know. You have a whole list on the website of the books that you will need to take with you when you do go for your certification exam as a CCA. I also recommend getting an evaluation in management coding book. It is like a breakdown book. I believe it's on the AHIMA website. You can check there for the resource materials to take this ECA. They will give you a whole wonderful list of all the books that they recommend. Now, I'm telling you guys, I highly, highly recommend that you heed their advice, okay? These are the people that administer the test. So it would behoove you to really look into those books. Now, I understand the books are expensive. And you studying on your own, if you don't really have any kind of direction to know what to do, first, it's going to seem overwhelming. But I will tell you this. As long as you like to read, as long as you drill and study, there is a CCA practice exam book. Okay, you can get that in addition to your books. If you are studying on your own, it is going to be a fraction of what you would have to pay if you went to a school. Now, I say school like this because a lot of times, now, we're all adults here, okay? So let's just be honest. When you go to trade school, there could be one or two things that happen. Either you have a bomb teacher, right, who really loves what they're doing, who is certified and really loves the field and will explain things to you. Then you have the other teacher who will just sit there and proctor from what's in the book and not teach you those critical thinking skills, okay? Or you can be like I was, and basically you're learning from an online program. I went to a school, but the school was like a trade school for many different things. They had people from real estate in there and secretaries and things like that. So we all learned online. And that was the extent of my learning. You know, I didn't really sort of develop this passion until a few years ago. Okay, I've been in the field for over a decade. Okay, just over a decade. And during this time, I have really grown to love the field. I have grown to know what it means to have passion about what you do. Okay, I like to share the things that I know because a lot of times people don't think about certain things like reading the guidelines. Now, this may seem elementary to a lot of people, and they may say, really, Blue, read the guidelines? Yeah, read the guidelines, particularly when it comes to evaluation and management. And yes, we are going to have some updates to evaluation and management starting next year. I get it. But it is a good foundation for you to know the basics now, okay? It's not going to change. It's going to change, but it's not going to change so drastically that if you have the foundational knowledge first, it's not going to help you. You see what I'm saying? It will definitely help you if you know the basics now, okay? The same thing with the diagnosis coding guidelines. I'm telling you guys. Again, it may seem elementary to really review the guidelines, read the guidelines. Yes, because the more you read, and it may not even make sense to you now, but the more you read it, the more later on when you're going along, it'll be like, I remember seeing that. I remember looking at that. So again, take advantage of what the book is telling you. You get to take the books with you when you go sit for the exam, okay? Your diagnosis and your procedure books, okay? You get to take them with you. Don't go all crazy writing in them, okay? And if you are taking an AHIMA credential exam, do not tab your books and do not get used to your books being tabbed, because with AHIMA, we have to have our books clean. There can be no tabs on the books. The books have to be clean. So with AAPC, they do allow for tabbing of the books. Their requirements for testing is a lot different, okay? But I'm just telling you, if you're going to go with AHIMA, tabbing is a no-no, okay? So get used to learning how to flip the book and know where your sections are, okay? It's very, very important. I have essentially grown up without having to have the tabs. If I do tab them now, it sort of gets in my way and I end up ripping them off later. But that's just me. But I've been in it for a long time. So it is going to be different for everybody. Okay. But that's the first part. Okay. Those are your big books. So your study guide for the CCA, your ICD-10 CM expert for physicians, the current year, the CPT book for the current year, the PCS book for the current year, the HCPCS books for the current year. HCPCS book. This is just one book. Now, what else do you need to know? You need to know anatomy, physiology, medical terminology. You can go to the public library and check out any book that you want to when it comes to this, okay? Because the body hasn't changed, right? I mean, we know all the bones. They're not going to discover a new muscle. So it's really going to depend on if you need more pictures or if you need more literature, you know, when it comes to whatever you're looking at. That will be the difference there. I have used a coloring book to learn anatomy. It worked for me. So there is a lot. I'm telling you, there's a lot. So medical terminology, anatomy and physiology, pathophysiology. Now, you could check out a pathophysiology book in the public library. I've seen them. Okay. You need to check out a abbreviations book, and usually like they'll have like the nurse abbreviations book. Sometimes they'll have one for surgeons, but just get one to sort of familiarize yourself with abbreviations. Medical abbreviations can vary from place to place, honestly, because I have seen where my surgeons will put an abbreviation for something, and I will go to them and ask them, "Did you mean this?" And they'll say, "No, it's this." Really? Because right here in the book it says that this abbreviation that you're using means this. Oh. So I always try to break them out of that habit of using too many abbreviations. I tell them, you guys have to use full language. We want things to be clear. We don't want anything to be inferred. And yes, they do get upset with me. And yes, they do say, "Blue, why do we have to do this?" And I say, "Because do you want to make sure that everything is clear? Yes or no?" "Well, yeah, I just want to get credit for it." Okay, well, if I'm looking at it and I know you, right? And then an auditor looks at it and they don't know you, guess what's going to happen? You're going to get marked wrong. And then you may have to pay back money because you did not do it right. So again, let's be fair all the way around. Let's make sure that we started out doing it right, okay? Now, that's another thing too, and I'm going to get into that later on in a couple of minutes. So, that. And then we have pharmacology. Now, pharmacology, I sometimes forget. But yes, you do need to know pharmacology. The basic names of stuff, okay? The basic names for anticoagulants and for diabetes. And in the ICD-10 book, they have a section in there for pharmacology, and it breaks down all of the different drugs and what class they fall under. It is really a wonderful section. This is why I always recommend Optum 360 coding books. Just saying. So there's that. Then you have to look up medical law. Now, you may be able to find some, but AHIMA has a really good medical ethics and medical law thing that they refer to on the website. So make sure you look up those materials, okay? There was something else. What else was there? There was another thing. Oh, I was gonna say, shoot. Okay, for the time being, right there, that's pretty much the bulk of what you're going to need, okay? I recommend highly that you are using flashcards. Now, again, flashcards may be elementary, but when you are looking at like body parts and stuff like that on flashcards, it really does help to drill and commit things to memory. HIPAA, that was what it was. HIPAA. You have to understand forward and backward HIPAA, okay? No, I'm just telling you guys, that is one of the hallmarks of what we have to know. HIPAA. So make sure you are looking up those things. Ethics, law, HIPAA, and then, insurance. Medical insurance practices. Again, there's a recommended book on the AHIMA website, okay? So be sure to look at that so that way you know, because they are going to ask you, it basically, like when you're going through a program, you're going to have to take a program for like medical billing, okay? It does not necessarily mean that you have to be a medical biller if you are taking medical billing in the program. If you're studying medical billing, doesn't mean that you have to take it, that you have to do it when you get out in the real world. I'm just saying that when you do go for these practice tests, it's in there as well. You know what I mean? You're going to be asked a variety of questions. So be prepared, and knowing medical insurance, okay, is very, very key. CMS.gov, a treasure trove of information. CMS.gov. emuniversity.com, another one that it has a free section in it. And for all of those who have a hard time with E&Ms, it's understandable. E&Ms are the bane of your provider's existence. But like I said, it is going to change come next year. But again, you need to have that foundation, good foundational knowledge. Okay, so make sure that you study everything that you can now. Get on a good schedule when it comes to studying. Okay, that way you don't overwhelm yourself with a bunch of things, because it's going to get real easy to do that. Okay, so start out with the simple things like anatomy, physiology, medical terminology, pathophysiology, pharmacology. Start out with those things. Then start out by asking yourself questions about HIPAA, medical law, medical insurance, things like that. Ethics is another one that's really huge too. Release of information, things like that. Privacy, that is really, really big. And again, when you look on the AHIMA website, you will be able to find those books that are recommended, okay, for this exam. And also, using your practice exam book, make sure that you're doing the setting, right? Like you're sitting for the actual exam, okay? So in some practice exam books, you will see that they have multiple tests. Well, just test yourself and see where you are. But everything that you are going to need to know about medical coding is going to be in these books, okay? In the CPT, in the PCS, in the ICD-10 book. That's where your base foundation is going to be. And make sure that you go over those coding guidelines, because again, that's where you're going to know your basics. Okay, and then you can get practice workbooks with the answers. So as far as like looking up procedures and diagnosis codes, you can go through there. Now, I have Quiz Friday, Answer Monday episodes. My exercises are not official. This is just me as a veteran medical coder sharing the things that I know. I have a huge, huge passion for orthopedics and podiatry. You all know this if you've watched my videos before. And so a lot of what I do, I try to make it a variety, but where I am like most passionate about, because a lot of people get confused with injury coding, injury versus organic. Okay, I still have to do a video on that one. I promised a viewer I was going to do a video on that one. This week has been really crazy, and today was my first day working at home. So I will have to do a video, but I'm going to talk about it on Patreon. So, but anyway, not to give my Patreon a plug, but yeah, my Patreon is a plug. It's Medical Coding with Bleu, all one word, if you're curious. I just talk about coding, I talk about my life, I talk about more detailed things than I do on here. And that's just what I do on Patreon. So, but yes, so that is pretty much the bulk of it. I know it sounds like a lot of books, and it is, because that list gets pretty long. But if you want to skip going through a program, I mean, absolutely. Do I think anybody can do it if they put their mind to it? Sure. You know, I don't think you have to go through a program, you know, especially if you want to get an entry-level credential like that. And another viewer has suggested a really good video, like if I would have known back then what I know now, what would I have done differently as a medical coder? And I'm absolutely going to do a video about that because there's quite a few things I have to say about that. So, but anyway, yeah, that's going to wrap it up for me. So, that is what you need when you are studying on your own, and developing those critical thinking skills, using those practice books, okay, getting lots of practice, looking up codes and looking up diagnosis and procedures and things like that. I did wash my hands, just so you guys know. Of course, somebody would be messaging me now when I can't turn this off without turning you guys off. So anyway, I'm going to go ahead and just wrap it up. And I will see y'all on the next video. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye!